Many runners and active patients come to the clinic with persistent pain on the outer side of the knee, especially when running, doing squats, or climbing stairs. In most cases, the source is the iliotibial band, a structure subjected to tension that, if not managed properly, causes friction and recurring discomfort. The real problem isn't just the pain, but what you can't see: muscle imbalances that alter movement. For example, what if the TFL is working too much? And what if the gluteus medius isn't activating properly? Without objective tools, these dysfunctions can go unnoticed, become chronic, and complicate treatment. With surface electromyography, you know exactly which muscles are active, which are compensating, and which are inhibited, even when the biomechanics appear correct at first glance. In this post, you will learn through a real clinical case how analysis with electromyography was key to understanding the origin of the pain, planning the treatment, and speeding up the patient's recovery. A muscle imbalance occurs when some muscles are hyperactive, that is, they work too much, while others are hypoactive, meaning they work too little. In the case of the iliotibial band, this can cause excessive tension, hip instability, and repeated friction at the knee. These are the most common patterns we find. The tensor fasciae latae, in this case it tends to be overactive, creating constant tension on the band. In the vastus lateralis, you may also find hyperactivation, pulling on the kneecap and increasing pressure on the outer knee. In the gluteus medius, it is most common to find an activation deficit. In other words, this muscle will fail to properly stabilize the pelvis. This triangle of muscular imbalance creates the perfect environment for symptoms to appear. So, the proposal is to conduct an evaluation using electromyography. Let's look at the real case of Martin. Martin is a 32-year-old patient, an amateur runner with no significant medical history, but with a problem that was holding him back. Constant pain on the outside of his left knee every time he ran for more than 20 minutes, or did deep squats. He had spent weeks trying stretches, foam rolling, changing his shoes, but nothing seemed to really work. When he came to the clinic, we decided to assess his muscle pattern using surface electromyography. We wanted to objectively understand what was happening with the muscles surrounding the iliotibial band. The first step was to evaluate the squat. We asked Martin to perform a series of squats. We placed the electrodes on the gluteus medius, the TFL, and the vastus lateralis. When we reviewed the data, it became clear to us. Take a look at the graph. The left TFL is overactive. The left vastus lateralis also shows excessive activation. The band was overloaded due to a poorly adapted compensation pattern, and most importantly, we wouldn't have seen it without the electromyography. Visually, the execution was correct. Movement control did not show major alterations. The second step was to assess running, the movement that caused the most pain. What was the result? Take a look at the graph. The gluteus medius muscles, in this case, are functioning properly. However, the left TFL is once again overactive. It overloads the iliotibial band, increasing friction at the knee. So why should we use electromyography in these kinds of cases? Without electromyography, this pattern would have gone unnoticed. The analysis has allowed us to detect muscular compensations that are invisible to the human eye, objectively measure which muscles are not working properly during real exercises, and design a treatment strategy tailored to the patient's data. Additionally, using biofeedback with electromyography will allow both you and your patient to learn how to properly activate muscles like the glutes, reduce excessive activation of the TFL and the vastus lateralis, all in real time. Therefore, electromyography is a key tool for identifying the neuromuscular origin of pain in the iliotibial band. Personalizing treatment according to which muscle needs to be activated or deactivated, increasing the patient's confidence by allowing them to see and understand their own activation pattern, and retraining them in real time. See you in the next post.